All right, so good morning, everyone.
Good morning.
Thank you for joining us for the November meeting of our Birmingham Area Coalition of Adult State Health Policy Center. As you all know, we're kind of in a season where we are getting more data in, and so we want to make sure that we're sharing that information with you guys as we're getting it in, so that come the first of the year, we'll really be able to dive a lot more heavily into the development of our community action plan. So last month we had an opportunity to hear from Dr. Hood regarding the preliminary data that we've gotten back from Birmingham City Schools on school wellness. This month we have an opportunity to hear from Dr. GSHPC, who is an associate professor with the with the Department of Civil Construction and Environmental Engineering here at UAB. And so I'm going to introduce her, and then I'm going to turn the presentation over to her. Dr. GSHPC is an associate professor, like I mentioned, of Civil Construction and Environmental Engineering at UAB, and the UAB Transportation Program Director. She has 25 years of academic and consulting experience in the areas of traffic operations and safety, intelligent transportation systems, and non-motorized transportation. To date, her research work produced 190 referee books, chapters, journal articles, and peer-reviewed conference papers, and she's been recognized by many professional organizations, including ITE, FHWA, the Illinois Association of Highway Engineers, IEEE, and the Women's Transportation Seminar. She is also the recipient of the 2010 Dean's Award for Excellence in Mentorship and the 2007 President's Excellence in Teaching Award. She's an elected director of research and education for the American Road and Transportation Builders Association and a fellow of the Institute of Transportation Engineers since 2014. So without further ado, I am going to turn this over to her, and we'll hear the data that she's collected so far.
Okay, great. Thank you so much. I really appreciate this introduction and also the opportunity to be with you today. I'm a civil engineer by training, and I don't know how many engineers we have here, but typically where I present and where I visit, there are not so many women in the room. So I think I should hang out with you a little bit more often. It feels good. Today I thought I'll take this opportunity to give you a little background on what we are doing related to transportation, focusing it a little bit more on active transportation as was suggested in my group. So I will give you a brief update on our interest and work. So a lot of the work that we do in transportation engineering focuses on traffic operations and safety. So we have research that looks at how to optimize signals, for example, how to use more efficiently the facilities that we have currently by adding new equipment or have different utilization of certain lanes like HOV lanes and so on. We have a strong emphasis in traffic safety, and a lot of the work that I think may interest this group relates to safety as well. So when we talk about traffic safety, we are interested in safety of all users, including non-motorized users. And so as we see more active transportation, increasing active transportation, then we have to carefully consider the safety aspects as well. In the transportation laboratory, we have equipment and a lot of software. So we use traffic simulation software to do a lot of modeling work. You will not see much of this in today's presentation, but I would like to mention all of this about what we're doing. We have a strong expertise in intelligent transportation systems. We hear you use a lot about connected vehicles now, autonomous vehicles able to move by themselves. And these, although they may not seem directly related, they may actually have a very important relationship with aspects that this group may have an interest in. So if these vehicles are moving by themselves, would they be able to capture the movement of pedestrians, small pedestrians, how they will interact with bicycles? We do not have the same facilities as bigger vehicles, you know, as far as having equipment and sensors and so on. And of course, human factors in transportation is another very important area where there is some relevance between what the community involvement groups as well as engineers and planners is focused on. Some of our work has a more direct link with community planning, so we look at how we can design, as well as implement solutions that promote smart and sustainable communities. And smart, of course, you know, has to do with the introduction of technology as far as usability is concerned. Progress the slides from here. That's changeable. Okay. Yeah. So for livable and walkable communities, we look at design options that use what we call context-sensitive design. So the way that we design our transportation facilities should actually serve better the overall goals and needs of the community. Transit-oriented developments were granted as part of the equation and how we build the communities and how we create opportunities for people to use alternative modes of transportation as well as, you know, walk more and live in a more livable environment, green spaces. And some of the work that directly relates to provisions for pedestrians and bicycles, from building designated bike lanes to just having streets so people can walk, you know, without really having to suffer from the heat and other elements. It's an important part of our work in this area. Traffic calming, many of you may be familiar with the term where we go to communities and we try to slow down the vehicles there by introducing small traffic circles or other interventions in order to reduce the speed primarily and improve conditions for pedestrians, bicycles, and other users. Also improve the safety of those users within the community. And also, you know, building communities that will have a good mix between the types of land uses that are used for residences as well as for kind of work and for services and so on, so people will not have to drive from place to place, but rather, you know, find a lot of things within close distance from where they are and so their quality of life and increase their access to transportation. Also, some of the work that we do has to do with providing choices, transportation choices to the users. For example, public transportation. We don't see all that much here in Birmingham, but you know, definitely public transportation is directly linked with the active transportation. as well. And of course, providing infrastructure that would support active mode. So from greenways, bikeways, crosswalks for the pedestrians, and so on. Okay. All right. All right. Can you hear me a little better now? Okay, great. Thank you. So as far as our sponsors are concerned, we work collaboratively with many other folks, and the research is primarily sponsored by the U.S. Department of Transportation, the Alabama Department of Transportation. Regional Planning Commission is a very good partner of ours, and it is likely that it is partner in the efforts of this group as well. And also, we get a lot of our work funded through the University Transportation Program. We are partners in 3 university transportation centers. The first one, we'll get there. Yeah, so the first one is the STRIDE Center, is the regional University Transportation Center for the Southeast. And it's led by the University of Florida. We have 8 partner universities there, and some of our research is collaborative with universities such as North Carolina State, University of North Carolina, Mississippi State, Georgia Tech, UF, and so on. And the theme of this transportation center is on safety, livability, and economic competitiveness. So livability, which relates to the theme that you have an interest in, is part of the Southern Region UTC. And we are also involved in 2 other university transportation centers, the one led by the Georgia Tech, and focusing on safety primarily and economic competitiveness, and the other one led by UTK and focusing on safety. But today, Maria asked me to talk a little bit more about active transportation, and also focus on an example of some of the work that we are doing. We have recently done collecting data. So I'll give you a couple of highlights. We have one project that we worked collaboratively with the University of Florida and North Carolina State University, for example, that looks at the interactions between pedestrians and drivers. So as part of our research work, we have collected a lot of data, both here in the Birmingham region and also in North Carolina and in Florida, to really be able to develop models that would describe the pedestrian behavior. So we develop gap acceptance models, for example, for drivers that allow, that show how the drivers make a decision on stopping as they approach a crosswalk and they see a pedestrian approaching and ready to cross. And also models that look at how the pedestrians actually accept the gap. So as they are ready to proceed by looking at the upcoming traffic, if they will decide to proceed or not, and what are the characteristics or the factors that would affect those decisions. So through this work, which is quite unique, we will be able to update existing simulation models to take under consideration those behaviors, because most of our models, which is a shame, actually only focus on the
on the only take into account what is important for the automobile and disregard to the non-motorized users. So we hope that this work will have a lot of benefit on how we model facilities in the future. Another example of collaborative work is with the psychology department. There, we worked with them to develop a virtual reality environment and train young kids, age 5 to 6, on how to properly cross the road. And that was a cool experiment, actually. We had kids that would come and pretty much use the virtual reality as a game. So based on what the environment would look like and how the vehicles will come and so on, they would press a button when they thought that it is safe to walk and so on. And sometimes you will see that this didn't work well. And we were able actually to collect a lot of data this way as well, to be able to study their decisions and their behaviors.
I have a question.
Sure.
What schools were these trials conducted at?
Well, what we did for this particular project, we worked with the YMCA, and so we worked with them during the summer, and so they would we would put the simulator, the virtual reality simulator there, okay. And as the students will come, they can test it. But it is available. Actually, it's a very good tool, and so schools that have maybe after-school programs or whatever, that they can actually request this, and we can move it to their facility, and they can use it as a training tool as well.
You request it through the, where did you request it, through your program?
Yes, you can request through me or through Dr. Schwebel, who is in the psychology department. And sometimes some of the work that we do is a little bit more general. In this project, for example, we used some information to assess how sustainable a community is. But as part of the sustainability, we focused on neighborhood development and transportation. And through this, we also developed some educational modules, which we used later on to develop a new course in our curriculum. And this is for green sustainable design. Many of you may be familiar with the LEED certification for sustainability that applies to buildings, but this particular component of LEED applies to community settings, and we thought that this is a cool thing for our students to be able to be exposed to. So the project that I would like to discuss with you more today is this one. It is a UAB community survey. Several of you are UAB faculty and staff and may have seen this survey actually, or may have replied to this survey a while back. What we did is we wanted to distribute the survey to learn more about what UAB students and employees choose to do as far as transportation is concerned, and what they would like to see in order to improve their transportation experience to and from the campus as well as within the campus. So we contacted this survey, and Maria and Ebony suggested that I will give you a little bit of more detail on this. So the survey was we had two survey tools. The one applied to employees and then one for the students. 80% of the survey questions were similar, but we had some that were designated to each one of the groups. So today I will give you a little bit more background on the employee survey and results. And of course, we have the student survey results as well for anybody that is interested. All right. So the reason we decided to do the survey is that the campus does not have any specific information about commuting patterns and travel preferences of our users. You know that UAB is the largest employer in the state. We have about 21,000 employees and almost 20,000 students now. So we are a very large institution. So it isn't, and we are projected to grow even more. So it is important to know how well we serve as an institution, but also as a community, the needs of the commuters in the area. So we decided that it was about time to collect documents and to try to make sense of the commuting patterns of the UAB employees and students. And this is what we did. And the reason is that we wanted to really benchmark the commuting practices and preferences of the UAB community, and then hopefully, as other places have done before us, to come back in 2 years or in 4 years after initiatives like the ones that you guys are working on have been implemented, to see if they really had any impacts and whether the impacts were positive and where the new needs would be. So many of you I know work with 2 questionnaire surveys, so we developed a couple of comprehensive questionnaire tools to collect information, first of all, about demographics. So we had questions that looked at age, gender, type of employment, if they were part-time, full-time, if they worked every day or just a few days a week, if they owned vehicles, if they owned bicycles or any other modes, information about income, and so on. And then the second part of questions, which was also very important, was about commuting characteristics. So where did they start their trip? What time did they leave approximately? How far their home is to work? How long it takes to travel, and so on. And also we asked several questions about preferences. So do they usually drive alone? Do they use public transportation? What would it take them for them to consider alternative modes of transportation, and so on. I think the idea of surveying the UAB community was a very good one, but of course with every survey you have to go through the IRB permission process, and also to be able to kind of excite the people to give, a little bit of their time to answer the questions. So, and another challenge is to make sure that you have a good representative sample. So the larger the number of those that respond, the better it is. But also, you don't want to kind of focus only on those that would sit in front of the computer every time. You don't want to have biased results. So there are a few people, say, at certain positions in UAB that they may not even have a computer. So we went out of our way to actually meet with people at the facilities and even give them surveys, paper surveys or interview a few, so that we have pretty much an entire range of incomes and education levels represented. But the vast majority of the responses came through an online survey. And this survey we have started in late October last year, and we collected data for a couple of months, although we had the vast majority of the answers coming very soon after we posted. And I should say that the response was exceeded every expectation. So for both surveys, if you include the employees and students, we received more than 10,000 responses. We were thinking maybe we'll be happy if we would receive less than half from this. So we're very, very pleased. And I think it's not just because, then what we learned from this seems to be more representative, but also because it showed how important the issue of transportation is for our UAB community. So as far as the employees are concerned, we received almost 6,000 completed surveys. 71% came from female employees and 29% from male. We had a good representative sample as far as age groups are concerned. This is a nice normal distribution here. And we had a good representation from both the hospital side, 43%, and then the university side, 48% full-time, and then approximately 45% part-time employees. So I think this is good, so that we know that we captured pretty much everybody. As I mentioned before, we made an effort to have surveys that will cover the entire range of incomes, and we succeeded in that as well. So this is our distribution of reported income from the surveys, from less than 12,000 down here to more than 250,000 there. From the transportation perspective, it was important to know where these people come from. So we asked as part of the survey, what is your origin? We asked them to give us their zip code, and some also gave their complete address. And using this data, then we could, and GIS capabilities, we could develop maps like this. This one that you see here show where the trips come from, I mean, where people live pretty much and that come to UAB. So the more intense the color, the more trips that we have coming into UAB from these areas. So not surprisingly, from Homewood, Mountain Brook, Hoover, we have a lot of people coming in and so on. These are the red ones, the red zones, and then you can see that this area shows you that we still draw a lot of people that live further away, and this is quite important because often if we would like to have focused interventions, then we can actually do this more in more detail. One example is we work with the Regional Planning Commission to promote shared transportation choices. So by looking at this, they know which areas they should target. So if they have a van that people would like to share, then they can actually develop the routes accordingly, and also target certain areas in order to get people that would like to ride share. We also had questions to see from where they enter the campus. So this is presented here. So the majority, they say they come from an arterial street. 28% come from the south using I-65 south, and this again, it is important for us to make sure that we plan for the ramps accordingly and so on to reduce the congestion and serve those people's needs better. As far as where they come from, this is the distribution of reported distance. So the majority of them come from 4 to 10 miles away. I think it is important to see here that we have 3% that live on campus, and 10% that live within 3 miles from campus. And for the purposes of your work, this may be an important type of information because these people, if the conditions allow, they may be good targets for promoting walking and bicycling, while those that come from more than 20 miles away, I think definitely have no chance at that. And the same here, the time that they spend coming to UAB, which is consistent. We have built those so that make sure that what they report is truthful, and so we have some information like this to cross-reference. Now, what it's not big news, but it is still a little bit worrisome, is that 88.5% come to campus alone, and so another almost 7% are dropped off. So the vast majority use automobile, and this is, as I said, it's not a surprise, but it's not what happens in other places and in other campuses. So the share for walking was 3.2%, and for bicycling 1.6%. Now, we asked them, though, if they had a choice, how would they prefer to come to UAB? And this was quite interesting to see that from all these that drive alone, more than 30% would prefer not to drive alone. And from these 30%, several of them, here the bicycle share was 1.6. If they could choose, 7.2 would choose to bicycle. So there is an opportunity there maybe to encourage some of these people, same with the walking, and telecommuting is another interesting, now it's less than 1%, but more than 14% would prefer to telecommute and not even come to campus. And so, yeah, so this gives you some idea of, what are their real preferences, and but also some opportunities to change modes. We asked them specifically about this. We had a question about carpooling and what would it take for them to consider carpooling rather than driving alone. And they suggested that, some special incentives like monetary incentives could be helpful. Although about 40% said that regardless of whatever it's offered, they would not consider it.
I have a question.
Yeah.
So for this question, was there an option that they would consider switching if it was more feasible, not necessarily that there was an incentive available?
Yes. In fact, we asked them what would affect their choice. So, first of all, we asked two questions that relate to your question. The one is, what are the main considerations for selecting a mode? And there you would see that, safety, reliability, convenience, and time, they were pretty much equally important. Less important, the environmental impacts and the cost. But we also, I don't know if I have this slide. Because I thought we had a slide that was, this one answers your question. We asked them, if you don't want to use an alternative mode, what would be the reason for not considering it? And so we asked them why they don't carpool, why they don't use transit, why they don't walk or a bike. And for example, if you look at the walking, which makes quite good sense, the majority would say that it is not, the time is too long, you know, or it's not an available option because I live far away. It's not a convenient option. It's the yellow. It's not a safe option. So, you know, 600 of them that answered this question, they thought that, you know, walking is not really safe here, and so on. So yes, they have they had the opportunity to really express why they choose to drive alone, and this is a brief summary of this.
So for bicycles, safety is also very,
Yes,
like a lot of
yes, absolutely. And I think for the bicycling, because we had some other questions and some other input, because there are not too many designated bike lanes yet on campus, and you know, it is the actual traffic safety. For the pedestrians, as I have seen in other studies as well, when they say safety, they also mean security. So they are afraid of being robbed or, you know, mugged or whatever. So it's not just the physical infrastructure related safety, but also, you know, the feel of being safe. All right. We are going to another slide. We asked other questions that relate to parking, for example. This is a hot button issue, and you will see there. This is the drive alone. We asked them where they park and so on. Even the parking relates a little bit to the active transportation. There is this trade-off between having a convenient parking that is next to your office. You're not going to walk much there, and you have to pay a very high price for that parking, or the parking can be in the periphery, let's say, or in designated spots. But then again, you have to walk more or get the shuttle, you know. So there are these trade-offs on how we design the parking, as well as the cost of the parking. And we also asked them about using the Blazer Express to move from place to place during the day. Only 19% said that they use it or they would consider using it to move around the campus.
So before, when they used to have, what was it called before?
Yeah, the shuttle.
Yeah, was people use the shuttle more?
I think they did, but the shuttle was only for faculty and staff, so students could not use the shuttle, that shuttle, you know, the call-in ride share. But this one is available for them. So it seems that, you know, the students have embraced more the bus than the faculty and staff.
And do you see that, well, I asked this because one of the guys that works in parking said that they have a really great, they feel like they get a lot more use of the shuttle for hospital employees that park out at the commuter line. And so they have a lot of routes to make sure that the nurses and other hospital folks can get there. So do you see, are most of those 14% of folks maybe those hospital employees maybe using it to get from the lots that are further away to the hospital?
Well, those that park in these faraway lots and work on the medical campus, they all use the shuttle to go. I mean, typically the distance is long. But the question that we were, the answer that we were looking at was primarily if you move the car during the day, and if that would, and if you move the car during the day, nobody moves the car during the day, but if you need to move around, then would you use the shuttle for that, not for when you commute, when you come in the morning, but rather, you know, if you take during the day to come to the meeting or for lunch or whatever. But we did get a lot of input regarding the parking. and very specific comments about the parking and, you know, how it is convenient or inconvenient. A lot of the comments actually would say that the routes are not that convenient, and sometimes, you know, when there is a big rush in the morning and so on, they have to wait too long because the buses fill up quickly, and so yes, they use them, but they're not necessarily happy with them. And the same with the parking. We got a lot the paid parking, you know, to have pay for parking and be able to park a little bit closer, not in the periphery. Some said that, you know, they apply for parking for a designated spot. They are doctors. They need to run, you know, to this for a surgery, but they're on the waiting list for 4 years. You know, I mean, it is definitely a tricky and very, you know, valuable resource. All right. So we asked them actually for feedback on what they really want to see more of, and parking spaces was what came on top. So 83% want more parking, which definitely, you know, goes against our idea of having more active transportation and reducing the use of the automobile and reducing the congestion on campus and so on. But they could actually choose more than one option here. So so parking was important, but interestingly, having more green spaces on campus as well as pedestrian facilities, being able, you know, to move around more safely and more freely. It was also very important input that they gave. So 33% would like to see the campus to be a more livable campus, and I think this is a good thing. It is definitely promising. Also, improvements on the Blazer Express service were noted, and there were a bunch of responses that dealt with improving conditions for bicyclists, and so including more bicycle racks, bicycle lockers, as well as bike share stations were some of the suggestions there that got some good attention. And I think this is good. Already the university, as many of you may be familiar with, had started plans and programs to put more bicycle racks, and we've seen this. And also they have the bike sharing program. Also, you know, you see these green bikes in several locations. So I think this is good. And I've been at UAB for about 14 years now, and I've never seen so many bikes as I see now, which I think it's a move again in the right direction as far as active transportation is concerned. All right. We also did some analysis with the data. The data is very rich and can give you a lot of good information. So we did some cross-tabulations, for example, when we looked at the mode choice, driving alone or motorcycle, bicycle, and so on, and their income. So you can see here, you know, the percentages of driving alone by income. The higher the income, the more they drive alone. Hard time. And it is the opposite when you look at the walk and bike. So the lower the incomes, the higher the percentage of walking and bike. No, these survey results are only for employees.
Oh, so okay.
Yes. Yes. And we have a similar, you know, set. I thought it would be a little too much to present all of this today, but I'm more than happy to share these results for the students as well. And we did do some comparisons and so on. So it seems still, you know, as in many other communities, you know, the income or the availability of automobile and so on plays a role in the decision of choosing the mode. We also looked at gender and how it affects the decisions. So here, as I mentioned in the beginning, we had 71% female and 29% male that responded to the survey. So as you look at this table, everything that is above 71%, that means that female are overrepresented. Everything that is below, that means that they are underrepresented. So just do this comparison as you look at the data. So what I would like to point out is that although the female and male drive alone, in similar percentages as we see as the responders, but when it comes to walking, definitely more male choose to walk than female. If you factor in, how the distribution of the responses, and the same is true with bicycling. And yeah, the motorcycles is even much, even worse. The differences are more pronounced. I wouldn't say worse or better, but they are definitely differences. And I think this is an important thing to keep in mind. So sometimes we would like to determine certain groups and kind of target some programs specifically for certain groups. So for sure, what we see at UAB, the female employees do not walk or bike at the same percentages as the male. Yes?
It depends on women. Normally have a responsibility for picking their kids up whenever the school calls, and so we like to walk and bike too. But
yeah, absolutely.
If you're expecting we got to run to the school whenever they call us. I mean,
Absolutely.
Sorry.
Yeah.
Sorry, I
Yeah.
like that.
And I share this because, I'm just, my office is just a few blocks from here, and today it was such a beautiful day, and I thought, well, I leave a few minutes early, and I'm going to walk. But then, one thing after another, I said, now I don't have time to walk. Let's jump in the car so I will be there on time. So,
You think it might be part of the safety thing too?
Yes, absolutely. And sometimes it's not the safety, but it is the perceived safety. So women feel more, a little bit more insecure at night to walk alone and so on. So there may be other programs also, that walk people from place to place, and many campuses have this for the students as well as, I guess, can apply to the employees. But absolutely, this is a good point too. Let me just skip a couple, maybe to. Doesn't want to move, but there we asked them about telecommuting or switching modes and so on. So this is the slide that you see. But I think what was also very revealing is the thousands of comments that we received. We gave them a little spot saying, if you have any other comments, or any suggestions. And we received maybe 4,000 something comments. Thank God, with technology, we were able to sort them out. And so a lot of the comments had to do with the parking. More than 1,100 people, 1,100 employees gave comments about the parking issues concerning the cost, availability, and convenience and safety. And several actually mentioned transit, and I know some of you work around transit issues, and they said that transit is important and we need more options and more flexibility as far as transit is concerned. And some actually mentioned the need for more comprehensive rideshare programs. Yes.
I know that you used to have an escort service, or if you were leaving your office after work, you could call in and come and talk to you. So one, is that still there? And two, did any of all of the, I know that there's been like the institutional grade Guardian and all of these bigger pushes for safety on campus. How much of that is in response to what you all found out as a result of these surveys?
Well, that is hard to say. For the escort service, I would say definitely that pre-existed. So. But the surveys, people had an opportunity to I'm not quite sure. I'm not sure that it had an impact yet. And the reason is this is based on what they have usually been doing. So you have to really change something. You have to take a policy, decision to change something or add something. I think some impact from this work may have been in framing the campus comprehensive plan, because you will see compared to the previous plans, there are a lot of more issues that relate to livable communities, complete streets, how you design the facilities, adding bike lanes and so on. So I think this is something. And then we have others from parking, for example, that have a lot of interest in the results. But I think it takes years to see the changes, really, especially in the behavior of people. So, as much as I would like to say that, things have been improving because of the work, I think we need to be patient and keep on, working on it and taking actions to really create opportunities for people to think outside the box as far as commuting and sharing rides and walking and so on, and making sure that they have all the tools that they need in order to do so.
And I apologize for being late.
Oh,
so you may
fine.
have already mentioned it. How do you account for like age? Maybe it was accounted for. How do you account for special needs or health conditions of folks? How do you account for those kinds of things?
The age, of course, we ask the age question, and then because we get all this data, you can actually do some cross-tabulations or some cross-analysis looking at the age. I'm only giving you some samples of the type of analysis that one can do because of the time. Specifically about the accessibility needs for the handicapped and so on, we didn't have specific questions. Always it is a challenge with these surveys. You don't want the surveys to be very, very long. Of course, we had space there, and there were some comments that dealt with these issues. But because, ADA requirements are met in a large extent on campus as far as ramps, and so on, we didn't have many concerns and complaints, but we didn't have a specific survey to say if you have any limitations and how, the campus addresses those limitations.
UAB has its own bus system now?
They have an on-campus shuttle bus system, yes.
Was this survey done before or after you got your own system?
It was after. So the bus system was already in place when the survey was done. But there were some changes on the routes following the survey. So it was somewhere in between. Yes.
So it has improved things since, has that worked, is what I'm asking.
Yeah. Well, this we cannot tell yet. But what other places have done is that they do these types of surveys in a systematic fashion, so every 2 years, most typically. So our intent is in a year from now to come back and resurvey the community and see if their answers change or if they have specific comments, either praising or complaining more about the bus system, so we can look at different several of these issues in more detail then. Yes.
Was there any discussion about what I call skywalking? I was in Minnesota once, and you could walk for miles without being outside because their winters are so harsh. And so they have all these accommodations where I could just go from place to place to place without being outside.
Yeah.
And I know that a lot of these buildings, like you can go from Kirkland, because I do that a lot, all the way to Children's Hospital, but they're not connectors to the other buildings.
Yeah, yeah. And there were not specific discussions as part of the survey, but definitely some other initiatives that UAB has to increase the health of the employees and so on. They often provide those maps that tell you, you can walk like 2 miles during your lunch break from building to building, and you don't even need to be outside. And we have seen that there is a difference between the academic campus and the medical campus. So there are far more facilities, that can allow something like this on the medical campus. But it's not something that was part of the survey, nor was it mentioned in any great numbers to really make it a top priority.
The incident is actually feasible to do something like that. I think anyway, it's still a lot.
Still a lot of breaks, but there's a safety issue that somebody brought up
Oh, the
too,
safety
which kind of, with daylight saving time, you're not wanting, it's 4:30, but who wants to walk a long distance because it becomes dark so quick?
Yeah. And although, we cannot complain about the weather much here in Alabama, but still sometimes it's very hot. I mean, it may not rain at all or snow, but as it is in Minnesota, but these hot weather conditions still would discourage people to walk. So walking within, a system of walkways definitely is a good idea.
And I wonder how that impacts women who may not like wet.
Yeah, absolutely. And the same is true with biking. I mean, I know from companies, they have facilities for those biking to shower and so on. So except from this building, I don't think any other buildings have showers, readily available. So overall, and I know, that time is going fast, I think it was a very good exercise. We were able to collect a lot of data, and different groups can benefit from that as we update, our policies and our initiatives within the campus, but also as we work with the City of Birmingham and other partners, the Department of Transportation, the Regional Planning Commission, and so on. We can use this data as a reference in order to show what people are doing, what the real needs are, and how we can better accommodate those needs. And I think that active transportation should definitely be a part of this initiative, giving people choices, but also good choices. It is quite important. So I think maybe I should stop here just to see if there are any other questions, because I know you have a couple of items on the agenda.
So if none of the coalition members have a question, I have one that's related to, considering that this group is composed primarily of community partners who are interested in, because they came up with the idea that we need to address active transportation in Birmingham City from a policy perspective. If you had to identify one or two areas that this group could focus attention to moving forward, whether that was working specifically with UAB or working with the other large employers in the city, and given what you all have found from your survey, what would one or two potential activities or initiatives for a community group like this be, from your perspective?
Mm-hmm. Well, I think efforts that would encourage people to go out of the office and walk or bike would be important. While we focus more on the commuting, I think just using the active transportation, for the small trips from office to office, during the day as part of our daily life, would make a big difference. And I think a lot of people don't realize how much of a difference it would make to their health, and their well-being if they don't have the parking lot just underneath their office building, but it is further away, so that pressures you to walk the 8 minutes, each way to get from there. They think that this is a bad thing, to walk the 8 minutes. And why is that? Because, we go to the shopping mall and we drive from shop to shop. You get in the car instead of walking and going to the next shop. And it is a matter of education and a matter of, how we see things. And, Maria can, you can share the same, I think, vision in Europe where we come from. I mean, it is very different. People really have the walking as part of their daily routine. I mean, they don't even count the steps. I mean, you have to, 90% will use public transportation, and you have to walk to the public transit stop, carry your stuff, and so on. It's part of life. And I think at the end, you see that, the life expectancy is better in many places in the Mediterranean that I know better. I don't know, where exactly you come from, but, it is very...
One of the big issues in Europe is there is no space for the parking.
Yeah, absolutely, and these two. And cars are very expensive.
Downtown.
Yeah, gas is very expensive and so on. So it's one of it's one of these issues as you look them separately. I mean, who wants to pay more taxes? Nobody. I mean, I don't ask this question, but then again, if the tax on the gas is higher, maybe, people will not drive that much. And that will have a direct impact on traffic safety, but also it will have a direct impact on considering the alternative modes that will make more active lifestyle. So I think as far as the initiatives, I think strengthening the initiatives to make the connection between health and being active as part of your daily routine, I think it will be a very good thing. We can even just have everybody as orientation, or everybody wherever they are get brochures and things like that. I think it is necessary because we end up just sitting way too much. And definitely we can work also on other options related to transit, public transportation or shuttle transportation and so on, because these indirectly also have similar benefits.
And is there a particular policy that you'd like to see UAB implement or our city officials implement that might make walking and bicycling more feasible?
I think UAB, working with the city, can provide definitely better facilities for pedestrians and bicycles. And there is already some desire and some indication that they are considering, but we have a long way to go. First of all, I understand with the issues with the hospital and so on. I mean, we cannot close all the roads, but I know, I mean, I've been to Berkeley, for example. It is a no vehicle campus pretty much. I mean, either you have or not have a vehicle, there is no way to park on campus. So, I mean, people learn that this is what it is. I mean, you park far away and you will walk, or you could bike, or there will be a shuttle or something, something else, but a shared mode rather than having all these vehicles. So I think the university, yes, by changing the atmosphere and by on campus, as well as by providing some solutions like, good crosswalks, more time for pedestrian crossing, things like that, they may actually encourage people to walk more and provide a more safe environment. And the same is true with the bicycles as well. And they have, in certain pockets, they have introduced bike lanes, but those that bike say, well, yeah, but in the middle of the road, the bike lane goes away, and that may be a hazard, so I don't really want to put myself in that. So as an institution, definitely, they can have a more comprehensive approach on how to address non-motorized transportation issues within the campus setting and providing the right environment for people who, if they are motivated, can use those facilities and benefit. Okay? Yes?
Oh, sure. When it comes to, a lot of cities here, and I realize it's really broad thing to guess, but it sounds like a lot of the engineering has caused more distracted transportation, kind of similar to New York or cities where there's a lot of people, a lot of park. So there, it seems like it's more of a result of engineering than policy enforcement or educating people about the benefits of walking. So in a place like Birmingham, that is, a scenic town, but it is a highly populated city, is it more likely that engineering will sort of bring changes eventually, or is it more efficient push for policy changes to sort of help catalyze that?
Yeah, I think it should be a combination of both. And actually, it is the engineering, but it's also the planning and the development. So, you may have a community or an area, a neighborhood that is already developed. You can go as an engineer and retrofit some facilities so that, they become more accessible and more safe for the pedestrians. But our communities grow, or they have the potential to grow. So as planners, as we think ahead of what will happen in 5, 10 years, we can plan ahead. We can plan communities around, like the transit-oriented development that I mentioned in the beginning, around a major transit station. And, this will bring businesses there, like the park that we have now in Birmingham. It will create the opportunity for people to do more, to work more and live more active lives. But I think the engineering, the planning, the education, and the encouragement should all be there in order for us to change the way that we do things in the future and include more active transportation as part of our life.
Would you agree, though, that one of the challenges is that this campus is campus as well as medical? So you've got to accommodate the people who are not well enough to do all the walking, because we're sharing this space with a lot of people that have disabilities or too sick to walk from place to place.
Yes.
So that kind of presents a wonderful opportunity to work that out, but that is one of our, I guess, challenges, that this is a shared campus.
It is. And we also have to think about, access for the ambulances. I mean, we have to think about a lot of issues. We cannot close all roads and say, well, this is, what it is, a pedestrian campus. And so, but, for example, when they closed the roads and made the green space here, we all thought that we're not be able to live and operate without the streets that they closed. And now, you come to campus, you don't even know that there was a road there. I mean, things can change. They will not change day to night, automatically. But if there is will, and if there are groups like this that really think ahead, and put in the seeds for changes in the policy, for changes in the behavior, for changes in the infrastructure, then as this materialize, then you can see the transformation of the campus, and that will have an effect on the entire community in the Birmingham and even beyond. As we leave the campus, we may actually bring this with us to any community that we live in the region.
So is there any plans right now to close any more of the streets behind it into the green space?
They have some plans. I'm not that familiar. I cannot give you the specifics because I haven't looked at it lately. But yes, the university has hired recently a new person that has a lot of experience in walkable communities. He came from Atlanta, and I think this is a very good thing because he has the vision and he has seen these things happening, while some others may not even think that they can happen. So I think this is a very positive thing. I cannot tell you specifically the plans which street will go next, but I definitely can tell you that there are plans to further extend bicycling lanes. So the bicycling definitely is part of the agenda. and also add more trees or more shaded areas, nice areas for people, to enjoy the outdoors and so on. And this can also generate a lot of activity for active, more people walking and so on. So I think that there are some plans in place, and so definitely we have a long way to go, but at least there is some, it seems, some will to move in the right direction. You had a question?
I did. I was in some meeting, I was in there trying to remember which meeting I was in. They were talking about they wanted to redirect the traffic from coming off of the interstate there, University Boulevard. Are you still discussing that?
Yeah, I think so. Yeah, they are thinking of putting another lane, I think, for the ramp. There are some issues. They're looking often ahead of time, in anticipation of more problems that will happen. Yes, there are still discussions, and there is a possibility to really reconfigure the entire entrance to the University Boulevard. Any other questions or comments?
Thank you. I have one. What was the name of the simulation program for kids? Did it have a name?
It is a picture of the reality environment. It doesn't have a specific name.
Okay.
Yeah. This is the. Sorry. All right, thank you. So enjoy your lunch. We're just going to chat for a few more minutes. In your materials, you'll see at the end there's a flyer for a CBPR Partnership Academy. Some of you attended the symposium last year in 2015. And we were very fortunate to be able to bring in Dr. Barbara Israel and one of her community partners, Zachary Rowe. Well, they happened to be at the APA conference last week, and I bumped into her and we started talking, and she said, we are offering this year-long partnership academy, and I think it's ideal for the work that for the folks who are involved in the work that you're doing down in Birmingham. So CBPR is community-based participatory research, and many of you might remember that our grant project is couched in community-based participatory research principles, which means that community is guiding or has a joint share in the decision-making in terms of the research project. And so Dr. Israel, who pretty much wrote the book on CBPR, and her community partner, the Detroit URC, Urban Research Center, is offering this training opportunity. So we wanted to make sure that you guys were aware of it because the applications open in December 1st, I believe. And what they're looking for are teams of academic and community partners. And so there are a couple of you that I know that I'm going to reach out to just because, I think that you guys might be well ahead of the curve in terms of a team. But if there are others of you who are interested in applying for something like this, let me know. If you need assistance either finding a community partner or an academic partner, then that's something that we can assist you guys with. But it sounds like it's a phenomenal opportunity. In July, there is a 1-week intensive session where you and your partner go to Michigan so that you can participate in a week-long session, and it's an all-expenses paid trip. So definitely give it some thought. And if you can't use it for your organization or the work that you're doing, definitely pass it along to someone else because we want to make sure we get this information out as far and wide.
I think I read somewhere, and I can find it now, that the partnership, they don't have to have a specified project in mind, right?
Correct. You don't have to have a specified project in mind, but it wouldn't help if you and your partner like each other. Right?
Well, that would help,
and get along with
it's
each
not
other.
like there has to be a project already underway or already.
Exactly. Exactly. But some of you, I know, have some ideas already kind of generated, and so, you know, if you want to expand on that, then we can get you connected to someone who can do that. But you definitely don't have to have an idea in mind. That you'll get the session. It's a year-long program, so aside from that week-long session that's in person, pretty much everything else will be done virtually. So you guys will, you know, meet through conference calls or video conferences. And then also you'll be mentored by someone, so you'll be able to have some additional meetings with your mentor during the year, so you and your partner can determine what it is that you want to work on. So I wanted to make sure we pass that along to you. Additionally, the CREPS program is almost here. It's November. It's mid-November already, and it starts the second week in January. So we have less than 2 months before it starts. We got a really good response, and we've already started reviewing applications. We still have some slots open, though. So if you are interested yourself, or if you know someone who is interested, I put a short link on your agenda so that you can access the materials. We have extended the deadline until next Friday, so if people can get their applications in by next Friday, then we'll probably be able to find some space for them if they qualify for it.
Just remind me, anyway, of the, like, who's eligible for this training? I mean, is it primarily people who are, like, employed by community agencies, or?
It is open. So the idea is that an individual would not have a whole lot of training or expertise in conducting community-based research. This program is to build the capacity of someone to be able to work in partnership with someone in academia in order to implement a community project, a community research project. That doesn't necessarily mean, though, that a person that's in academia wouldn't qualify for it. The idea is that, you know, the person would develop skills to be able to work collaboratively with community partners, or develop their capacity as an academician to do community-based research. So it's pretty much open to anyone. We've had students apply. We've had people who currently are working in research here on campus, but in some other capacity,
Okay, so
not community-based.
Getting into that kind of research?
Correct. Yes, it could be someone who, yes, absolutely. Okay. Okay. So anyone who has an interest in engaging in community-based research. Bianca, did you?
I mean, that's pretty much it. Some of our participants, or some of the applicants, like you mentioned, some are students, some are just lay community members. Yeah, that's what I was thinking about. Yeah, just lay community members. They don't connect to any particular well-established, you know, university or organization or system, but, you know, they have community ties that they're very active in their church, and they're, you know, maybe on ministry and things like that. Some participants, they're mentors in an organization, you know, so it's really, you know, they have different connections, so we're not looking for a specific type of person. Just the question that we're asking when these people apply is, what are you going to do with the information? And when we look at the applications, that's what we're looking for, is how are you going to apply what you're going to learn in this 16 weeks? And if we feel as though they have a good plan, and that's typically the person that we're looking for, so they have a plan for the information.
And I just really want to thank Jonice and Bianca for all of their help in coordinating the CREPS program. Bianca has been reviewing all of the applications and all of the letters of recommendation. So definitely kudos to you, and thanks Jonice for also helping. And so the last thing, I think this is the last thing. Was there anything else you wanted to? Okay. The city is hosting a meeting on November the 15th. November the 15th at 6 o'clock, and it's an opportunity for the community, for, you know, people who are in the planning profession, to come out and hear where the city of Birmingham is in terms of implementing the comprehensive plan. And so, as you know, in the comprehensive plan, there's a whole chapter devoted to transportation. And so this is an opportunity for you guys to go out and hear where the city is. I'm pretty sure they'll talk about some of the studies that they started working on. I think they were doing a sidewalk study. Edwin can probably speak better to this than I will. So Edwin, you want to kind of just give us an overview of some of the things that the city has kind of started, and particularly the study.
Oh, okay. Well, the meeting, as you said, is really our annual public meeting. And it really is a meeting for the public to kind of understand where we are with the status of our implementation efforts. We adopted the comp plan back in October of 2013. So we're several years into it. As it relates to transportation specifically, as you mentioned, there has been a sidewalk master plan that's been developed that really served to identify where we have sidewalks, where we don't have sidewalks, where we do have sidewalks, where we need for improvement. So it's really that kind of thing. And then there's another phase of that that's happening now to kind of deal with some of the functionality of those sidewalks to make sure it's ADA compliant and things of that nature. So the other thing that we'll probably give an update on is related to the citywide multimodal transportation plan. Part of this conversation that the doctor gave related to, the complete streets policy that we have. To some extent, we've had some challenges in implementing that policy, and that's because we haven't done an assessment of the functional capability of each street, because each street may not be designed to be multimodal. Some streets may only be for cars, some streets may only be for trucks and cars, and on. So the multimodal transportation plan will allow us to evaluate that, so we'll understand the functionality of each street and be able to assign what the mode should be and a priority for those modes. So that should be helpful and allow for the implementation also of that complete streets policy that the body that you served on helped to adopt, right? So we encourage everybody to come out to kind of understand what we're doing. There'll be a lot of discussion about what we're doing that impacts the built in the natural environment, but there'll be other activities too that we're doing related to sustainability, our interaction with public health, hopefully. There'll be some conversation there. So I think it'll be useful.
And if you haven't had an opportunity to check out the comp plan, it's online.
Yeah.
One of the things that may be helpful for you guys to do is to look at, and we can definitely make this part of the agenda at a future meeting, but look at the partners, because the comp plan isn't something that's implemented by the city of Birmingham.
Correct.
Alone. It requires a lot of partnerships, and so I think it will probably be useful for us to look at some of the partners that have already been identified to help advance some of the activities that are listed in the comp plan, because that might be helpful as we start thinking about how can we help. We may not need to reinvent the wheel, but maybe there are some opportunities for us to maybe fill a gap. And so looking at the comprehensive plan and those activities that have been identified and the partners identified may be something that will be of benefit to us as we move forward.
I want to ask, have you had an opportunity to maybe address with the planning department, your role on the coalition here and its benefits to the city?
I have spoken with my staff, so at that level, yes, we've had conversations, and we've implemented a number of different activities that have a public health focus to it, and to include our planning considerations. We do have what we call a departmental kind of overview meeting where we discuss things that have departmental-wide or city-wide impact. I haven't done a presentation in that setting, but we have done it at our level.
Any other questions, comments, concerns?
You want to give an update on the data, the policy data, where we are with that?
Sure.
So Anthony, before you do that, can you tell us where the meeting is going to be on the 15th or 16th? Where is that?
Should be
City
in
Hall,
the City Council chambers.
City Hall, City Council chambers, third floor. All right, so in terms of the policy scan, where we are, so we are really hustling, trying to get at least some of the high school principals to complete the survey. So between today and tomorrow, Aaron and I will be, making additional phone calls and pop-up visits at some of the high schools in the area to get these principals to fill out this survey. And don't tell me tomorrow's a holiday.
Oh,
yeah.
Thank you. Okay, so we won't be making pop-up visits tomorrow. That's going to happen this afternoon. And so we are also working to finish securing the list of HR directors who will get the survey. And we'll do something very similar to what UAB has done, not to that level of detail, of course, but really just kind of get a sense of what the larger employers across the city are doing. So we're hoping that we can push that out within the next week or two. And okay, and then also we will be following up with the 3 city officials to because we got some incomplete responses on those surveys, and so we'll be working with them to finalize those.
Have you thought about contacting the district board members, trying to reach out to their principals?
We hadn't, because we got a pretty good response from middle schools and elementary schools, but I think one of our coalition members has a connection to 2 of the principals, so we were going to start there. But I think that's a good idea because, we do have some connections to some board members. And so I'm sure one of our coalition members can help us facilitate that dialogue. So yeah, that's a great idea. Thank you. Yeah. Okay. We'll definitely do that. All right. Well, if there's nothing else, the next meeting, December 15th, we will not be in this room. We'll be downstairs again on the 4th floor. And but I'll send out a reminder today, or I'll put something on your calendars today, and then I'll send out a reminder. But we'll be on the 4th floor next month. All right. Thank you, guys.
Happy Thanksgiving, everybody.
Yeah. Thank you. Oh, I see.
My church is selling church.